The human voice is more than a sound. It is the instrument by which you express your thoughts, your feelings, your beliefs, yourself. One center at St. Luke's Medical Center will never let you lose your voice. Welcome to St. Luke's Voice, Swallowing and Sinus Center. St. Luke's Voice, Swallowing and Sinus Center is the country's most modern and fully equipped integrated unit created for the diagnosis, management, and rehabilitation of persons with upper aerodigestive tract disorders. It specializes in the evaluation and treatment of patients with voice-speech, laryngeal disorders, swallowing problems, and diseases of the nose and paranasal sinuses and oropharyngeal areas.
This center is equipped with all the latest state-of-the-art technology for evaluation of voice and swallowing disorders. First of all, we have the digital video laryngostroboscopy equipped with micro system as well as computerized speech lab. This evaluation or examination that we are using for this equipment is that sometimes we cannot just determine or examine it very well through a plain laryngeal mirror. But with this equipment, we'll be able to determine fully in a state-of-the-art the actual laryngeal problems, disorders. So we'll be able to determine what are the disorders of the laryngeal structures, its phonatory system, whether there's an obstruction, there's a tumor mass located in the true vocal fold. Because the main complaint of patients is hoarseness. Well, there are some disorders as determined by our equipment, such as the video laryngostroboscopy. There are times that we can treat this only by medical treatment of patient. We have to observe on that. But if there are disorders like vocal cord paralysis, if there are tumors in that in the true vocal fold, then we do surgical treatment.
The St. Luke's Voice, Swallowing and Sinus Center is equipped with digital video laryngostroboscopy with laryngeal microphone system and computerized speech laboratory to assess the patients with voice problems. It also has a swallowing workstation unit with digital video recording system for the evaluation of patients with laryngopharyngeal reflux and other swallowing disorders. The center is equipped with the most modern facilities for the diagnosis and management of nasal and paranasal problems. St. Luke's Global City is also the first and only hospital in the country with narrowband imaging technology, or NBI.
NBI is short for narrowband imaging. It is actually an optical image enhancement technology. Now, what do we mean by this? What we mean is when we look at the patient's anatomy, there is enhancement of a certain difference. There's a contrast between normal and abnormal. So that when you look at the patient, even the minute difference between areas can be identified whether a certain part is normal or abnormal. Okay, this is just an example. And you can see that I'm in the nasal cavity. And if I suspect the patient to have some kind of lesion. For example, this is a case of nasal cavity carcinoma. And if you put on the NBI, or the narrowband imaging mode, put it on please, you can see that there is right off a change, and I can see exactly where the blood vessels are in this case. So if I see any part wherein there is like for example, areas where there are more vascularity, and I suspect there is some kind of cancer in that area, then I particularly know where I will be doing my biopsy. The difference is, and I want to show you an example, is that you can see this is the ordinary light that is shown on the endoscope, and you can see an area of what looks like to be normal on the ordinary endoscope and an ordinary light. And you can see the next slide, wherein we use narrowband imaging. You can outright see that there's a difference between the normal, which is cyan colored, and the brownish lesion. And if you do biopsy that brownish lesion, you get cancer. So you can see ordinary, and when you have the NBI, you can detect right away where it's going to be. So another example, you can see with ordinary light, and this is what other hospitals would have. And if we apply narrowband imaging, you can outright see that this area here would have cancer. And that would have been easily missed with just an ordinary xenon or halogen light, which is the one that is available in all other hospitals except St. Luke's.
Catering to both adult and pediatric patients, the center houses a unit for upper airway laser and sleep disorder surgery.
Our medical staff here, the ENT specialists who are really, who have specialized in the voice and swallowing disorders. And most of them, most my staff have studied and trained a lot on this abroad on voice disorders.
St. Luke's Medical Center has been very generous to all our doctors in providing them the best in technology. And you can see like the narrowband imaging, and it's the only one in the country today. And aside from that, our doctors are sent by St. Luke's outside to constantly go into conferences, seminars, and lectures care of St. Luke's so that they are always advanced in technology and knowledge of the diseases of the ear, nose, and throat. So that's basically those two things. One is technology, and second is continuous medical education being sponsored by St. Luke's itself. And I think those two makes St. Luke's the best, if not one of the best in Asia, actually.
The St. Luke's Voice, Swallowing and Sinus Center, the country's most modern and most fully equipped integrated unit created for the diagnosis, management, and rehabilitation of patients with upper aerodigestive tract disorders. The first of its kind in the country. Only at St. Luke's Medical Center. Ultimately, it is expertise.